Weight management. Being at a healthy weight is important for good health and longevity. Currently, about 68% of Americans are either overweight or obese. Now, it's important to understand that there is no quick cure for overweight and obesity. So, maintaining a healthy weight is difficult in this obesogenic society. And when we say obesogenic society, it means that the fast food, the lack of opportunities for physical activity for some people, the environment that is set up, as well as societal cues and the media makes it very easy to gain weight and very difficult to lose weight. Losing weight and keeping it off requires hard work, commitment, discipline, and consistency. The ideal weight loss program combines decreased calorie intake, increased physical activity, and behavioral modification. Now let's look at energy balance because this is the key. Maintaining a healthy weight is a matter of energy balance. Energy intake, calories that we eat from food, must equal energy output, whether or not it's from physical activity, your metabolism, and other bodily function. When energy intake is greater than energy output, when energy intake is greater than energy output, the result is positive energy balance. The excess calories that are eaten are stored, which results in weight gain. On the other hand, when energy intake is less than energy output, there's a calorie deficit and negative energy balance results, which is necessary for successful weight loss. Negative energy balance or weight loss involves loss of both lean tissue and body fat. This equation can be deceptively simple, though, because it doesn't account for the multitude of factors that affect what we eat, how much we exercise, and how our bodies process all this energy. So it's important to note that 1 pound of body fat equals about 3,500 calories, and a reduction of about 500 calories a day can result in a 1 pound weight loss per week. So nothing drastic has to take place. So think about getting rid of a candy bar or a soda or a snack. And with these simple measures, and if you do them consistently, you can begin to lose weight by reducing about 500 calories a day. Energy intake. Energy needs are met by food intake, represented by the number of calories eaten each day. The desire to eat and energy intake is influenced by the hypothalamus, hormones, environmental factors, and psychological factors. The hypothalamus is responsible for the control of food intake. It has a feeding center, which increases food intake, the satiety center, which decreases food intake. So the signals go to the brain when you're hungry to increase your intake, and when you're full, your stomach sends the message to your brain to say, I'm full, I'm satiated, please stop eating. The hormone ghrelin stimulates the appetite, And insulin suppresses the appetite. And studies have shown that obese individuals may also be insulin resistant. We also have leptin, which suppresses the appetite. And again, studies show that obese individuals may also be leptin resistant. We also look at peptide YY, which suppresses the appetite. And this is responsible for part of the signal that goes to the brain from the stomach when the stomach is full. Low levels of peptide YY may be an indicator of type 2 diabetes or higher risk for type 2 diabetes. Oxyntomodulin also is a hormone that we believe suppresses the appetite, and it is also responsible for reducing the concentration of ghrelin. Environmental factors. So visual cues, if you're a very visual person, if you see something, even if you weren't hungry, all of a sudden you see some cookies or a piece of pie, or you look at the dessert list, and those visual cues, even a TV commercial. And that is the reason why advertising is so effective, because it works on our visual cues. Your home environment affects the way you eat. Your family and social network. You may tend to eat out a little bit more when you're around certain people. Also, if you have a family environment where healthy foods are available and your family exercises a lot, then you probably will adopt some of those eating habits, as opposed to if your family and social network exercise very rarely, junk food is just very prevalent, and everyone tends to overeat at meals. Work environment also can be very influential. Sometimes people feel very pressured to eat or go out to eat. And sometimes in the break room, especially on a Monday morning, people just bring in all sorts of cookies and treats. Fast food and vending machines, the availability every time if you walk past a vending machine, especially if it has your favorite snack, that also makes a difference. We also have to acknowledge that food is a source of pleasure and comfort. If we did not enjoy it and got some pleasure from it, we probably would not do it. But we eat and overeat because food is a source of pleasure and comfort. It is also used as a way to cope and self-medicate. People have different types of coping mechanism. When people are stressed or anxious, disappointed, frustrated, anxious, they eat. Some people may do drugs, use alcohol, oversleep, but for some people, eating is a coping mechanism. We eat when we're happy, we celebrate, right? And we eat also when we're depressed, sad, and anxious, when we're stressed, and when we're anxious, and also when we're tired and bored. So you can see why all of these things combined make it quite difficult to maintain a healthy weight. Now let's look at energy output and the things that affect energy output. So the body uses energy for 4 general purposes: basal metabolism, physical activity, the thermic effect of food, and thermogenesis. Basal metabolic rate, or BMR, is the minimal energy it takes to keep the resting, awake body alive. Okay, think of couch potato status. Basal metabolism accounts for about 60 to 70% of total energy used by the body. Your BMR uses even more than exercise. So, what is included in the BMR? It includes maintaining a heart rate, respiration or breathing, regulating your temperature, and other bodily function. However, it does not include energy needed for activity or digesting foods. The BMR for men is 1 calorie per kilogram of body weight per hour. And for women, it is 0.9 calories per kilogram of body weight per hour. Notice now that when we are talking about weight loss and BMR, we are actually now using the metric system. If someone is not fasting or completely rested, the term resting metabolism is used and expressed as the resting metabolic rate, or RMR. The RMR is typically 6% higher than the BMR. So what factors increase BMR? Gender. Males have higher rates of BMR than females. Having more lean body mass. The more muscular you are, then you are likely to have a higher BMR. Your thyroid hormone levels, pregnancy and ovulation, muscle mass. If you're going through fever, stress, or trauma, and when we talk about trauma, it's usually like physical trauma, if you've had surgery, an accident, things like that. Recent food intake, your BMR increases slightly. Recent exercise, again, BMR increases slightly. And caffeine intake increases the BMR temporarily. Age. BMR decreases with age. So as we get older, we tend to sometimes gain weight because our BMR gets lower as we age. In fact, BMR declines about 2% every 10 years after age 30. So it gets a little bit more difficult to lose weight as you get older. Low-calorie diets. These diets actually begin to reset your BMR because your body's first instinct is to preserve itself. So when someone goes on a low-calorie diet, the body holds on as much as possible to prevent itself from going into starvation mode, and your BMR will drop. That is the reason why low-calorie diets are not recommended. Going along with this is chronic dieting, the yo-yo dieting. You lose 5, you gain 7. You lose 7, you gain 10. And unfortunately, a lot of women and girls have been chronically dieting for a while, and their BMR may be lower just because of the chronic dieting. Energy output again. Physical activity is the biggest variable in energy use among people. Physical activity increases energy expenditure above and beyond BMR by as much as 25 to 40%. So the physical activity is within our control for the most part. The high prevalence of obesity in our society is partly due to inactivity and a sedentary lifestyle. We also have the thermic effect of food. And this is the amount of energy used by the body for digestion, absorption, and processing of nutrients. The thermic effect of food is similar to a sales tax that charges the body 5 to 10% of calories consumed. So, if you consume 2,000 calories, the thermic effect of food would account for 100 to 200 calories. This magnitude depends on the food consumed. So for carbohydrates, about 5 to 10%, proteins, 20 to 30%, fat, 0 to 3%, alcohol, about 20%. In addition, Large meals result in higher thermic effective food values than the same amount of food eaten over many hours. Thermogenesis. This is the process of producing heat. In human, it is increase in non-voluntary physical activities. So examples of non-voluntary activities include shivering when cold, fidgeting, maintenance of muscle tone, and maintaining body posture when not lying down. The contribution of thermogenesis to overall calorie output is very small, and that is because we live in climatically controlled environments. So if we're cold, we would put on a sweater, turn up the heat, grab a blanket. And so thermogenesis really would kick in if you went camping and stayed out really late, or you got lost and your body just started shivering so much in order to generate some body heat. But again, this does not happen in a normal everyday situation. Now let's look at some facts to consider about weight loss. First, the first few pounds that is lost is usually water weight. So if a diet promises that you will lose 10 pounds in 3 days, you're losing water. Weight should be lost primarily from fat, not from muscle and other lean tissue. And remember, it takes a deficit of about 500 calories per day or 3,500 calories a week to lose 1 pound a week. There are many physical and psychological risks of dieting. And one of the key things to understand is that the body will do everything it can to resist weight loss. The thyroid hormone levels and the BMR drops. Preventing obesity then should be emphasized. There is no cure for obesity, and in fact, only 5% of people who lose a large number of weight, like over 50 pounds, for more than 2 years, only 5% maintain their weight loss for more than 2 years. People tend to regain weight loss. And again, creating the yo-yo effect or weight swings. And so it just sets you up. You lose weight, you gain weight, you lose weight, you gain weight. There are also some physical risk of dieting. Inadequate nutrition, metabolic changes, drop in BMR, increased risk for cardiovascular disease, sudden death from cardiac arrhythmias. And these two factors are extremely important, especially when we begin to talk about eating disorders and anorexia, that people who suffer from anorexia also at high risk for sudden death from cardiac arrhythmias. Shift in body fat composition. So it's not just that you lost 5 pounds and gained 7, but the repeated yo-yo dieting also means that what you're regaining is more body fat over time. Increased risk for hypertension, general weakness, and fatigue. Now, the psychological problems with repeated dieting. An increased sense of failure because all of the focus is on losing weight and seeing what the scale says. Increased pressure to conform to societal standards of beauty. Increased risk for eating disorders. Increased tendency to binge. After you've deprived yourself, then you feel you have to compensate. And so when you lose it, you really lose it and go on a binge. Mistrust of body cues and signals. Heightened responsiveness to external cues. Weight obsession and poor self-image. So the old measures of success: Many individuals consider weight loss as the primary measure of success. And this view puts too much emphasis on what the scale shows and can perpetuate a sense of failure and reinforces negative behaviors when weight loss is slow. Putting too much emphasis on what the scale shows also may trigger eating disorders. So let us look at new measures of success. And the focus should be on improvement in medical condition, increased quality of life, decreased reliance on medication, especially for hypertension and diabetes, positive self-image, reduction in your waist to hip ratio, developing a positive relationship with food, healthful eating, and making progress. Fasting and weight loss. Muscles and other organs can use fat if they have to as a source of fuel, but the nervous system uses only glucose. If the body was to consume itself unchecked, that would result in about 10 days. Fasting and weight loss. Muscles and other organs can use fat if they have to as a source of fuel, but the nervous system uses only glucose. If the body were to consume itself unchecked, death would result in about 10 days. The body goes into ketosis to adapt to fasting, and ketosis is a condition in which ketone bodies in the blood are elevated. Ketones are formed when glycogen stores in the liver have run out, and ketosis reduces the nervous system's need for glucose. Ketosis spares the muscle and other lean tissue from being devoured too quickly, and it is promoted by many high-protein, low-carb weight loss programs and diets. And staying on a high-protein, low-carb diet for too long may result in high blood cholesterol, hypoglycemia, mineral imbalances, heart failure, kidney problems, and other metabolic abnormalities.